Hello parents, I'm Dr. Yatin Bhole. One situation that often confuses and even surprises parents is this. Your child's thermometer shows 102 or 103, but your child is still playing, talking, watching TV, or even asking for snacks. Parents then ask, Doctor, how can my child be so active if the fever is high? Is this normal, or is something being missed? Today I will explain why some children stay active despite high fever, and when parents should actually worry. First, let me tell you something very important. Children and adults experience fever very differently. Adults often feel weak, tired, and miserable even with mild fever. Children, especially younger ones, can sometimes tolerate higher temperatures and still remain playful. This does not mean the fever is fake. It means the child's body and nervous system are coping well. Now let me explain what doctors actually look at. When a child comes to the clinic, we do not look at the thermometer first. We look at the child. We observe. Is the child alert or drowsy? Is the child making eye contact? Is the child responding to voice or touch? Is the child drinking fluids? Is the breathing comfortable? A child who is active, responsive, and drinking is usually showing signs that the body is handling the illness well, even if the fever number looks high. This is sometimes called a non-toxic appearance. On the other hand, a child with even mild fever who is very sleepy, floppy, not responding, breathing fast, or refusing to drink is more concerning. Now let us talk about why children can stay active during fever. Fever is controlled by the brain, but energy levels are controlled by many other systems. Some viral infections raise temperature without significantly affecting energy or appetite in the early phase. So the child may have high fever but still feel okay in between fever spikes. Also, fever often comes in waves. During the peak, the child may look tired. When the fever comes down, even slightly, the child may suddenly become playful again. Parents often see this pattern and feel confused. Now let me reassure you clearly. An active child with fever is usually a good sign. It means the child is hydrated. The brain is functioning well. Oxygen levels are likely okay. The illness is not overwhelming the system. But being active does not mean you should ignore the fever completely. You should still monitor for warning signs. You should seek medical advice if your child has persistent lethargy between fever episodes, difficulty breathing, repeated vomiting, poor drinking or very little urination, severe pain, rash that does not fade, seizures, fever lasting more than a few days. Another common question parents ask is, should I still give paracetamol if my child is active? Yes, you can give fever medicine for comfort, especially if the child looks uncomfortable, is not sleeping well, or has body pain. But remember, the goal is comfort, not chasing a number. So let me leave you with this simple message. A playful child with fever is usually a reassuring sign. A quiet, unresponsive child with even mild fever needs attention. Understanding this helps parents stay calm and focus on what truly matters. If this video helped you, please like, subscribe, and share it with other parents. I'm Dr. Yatin Bhole.